Bismillahirrahmanirrahim. Dear students, so let's start. Today is our lecture number 25. So in this lecture we will discuss about the depolarizing agents. So what are depolarizing agents? So the drugs which includes and depolarizing agent that may be in the form of succinylcholine, succinylcholine and decamethonium. The mode of action or mechanism of action of depolarizing agents. So these drugs can act like acetylcholine but persist at the synapse at high concentration and for longer duration and constantly stimulate the receptors. Another mechanism of action and mode of action of depolarizing agents. So first of all, these drugs may cause opening of the sodium channels which occur resulting in depolarization take place, and depolarization this will lead to transient twitching of the muscles, continued binding of drug make the receptor incapable to transmit the impulses and paralysis will occur. The continued depolarization makes the receptor incapable of transmitting the further impulses. The clinical uses or therapeutic uses of depolarizing agents when rapid endotracheal intubation is required. So these drugs are used, depolarizing agents are used, and these depolarizing agents they are also used during electroconvulsive shock therapy. The pharmacokinetic of depolarizing agent is it can be administered intravenously due to rapid inactivation of the plasma cholinesterase given by the continual infusions. Succinylcholine. So succinylcholine is a depolarizing agent. It can cause paralysis of the skeletal muscles. The sequence of paralysis may be different from that of non-depolarizing drug, but respiratory muscles are paralyzed, lost. It produces a transient twitching of the skeletal muscles. So the skeletal muscle it become rigid, so it become hard before causing block. It causes maintained depolarization at the end plate, which lead to a loss of electrical excitability, and it is shorter duration of actions. It also stimulates the ganglion, sympathetic and parasympathetic both. At low doses, it produces negative inotropic and chronotropic effect. As I have already explained in physiology, the inotropic effect means when there is strong contraction of the myocardium muscles, and when the response of the myocardium muscles it become weak, so it is called chronotropic effect. And high doses it produces positive inotropic effect, and it means that in positive inotropic effect the myocardium muscle contractility become increased and the chronotropic effect as well. It acts like acetylcholine but diffuse slowly to the end plate and remain there for a long enough that the depolarization cause loss of electrical excitability. If cholinesterase is inhibited, so it is possible for circulating acetylcholine to reach a level sufficient to cause depolarization block. These are the various ADR adverse drug reaction which are reported by depolarizing agent. Bradycardia may be occur, bradycardia may be prevented by atropine. Hyperkalemia in patient with trauma or burns. This may cause dysarrhythmia or even cardiac arrest may be occur due to the use of these medications. Increase intraocular pressure due to contracture of the extraocular muscles, increase the intragastric pressure which may lead to emesis and aspiration of the gastric content. As I am already discussing about the different type of unwanted effect, as I am discussing for each and every drug. So a problem is that it is not necessary, this is very rare, so it is not necessary that these unwanted effects it may be produced in every individual. So it is not necessary, these are very rare, but it is very important to adjust the dose in order to keep a proper balance. There may be chance of malignant hyperthermia. So malignant hyperthermia is a rare inherited conditions probably caused by the mutation of the calcium channels or the calcium release the chain of sarcoplasmic reticulum, which results in muscle spasm and dramatic rise in body temperature. So this is treated by calling the body and administer of dantrolene. Let's suppose if this condition has occurred. So when this condition has occurs and we are going to overcome on this condition, then dantrolene is used as an antidote. Prolonged paralysis may be occur due to certain factor which reduce the activity of plasma choline stress. Genetic variants such as abnormal choline stress at severe deficiency anti-choline stress drugs are used, and neonates and liver disease may be occurs.